Hi, I'm Dr. Colleen Cotton. I'm an associate professor of dermatology and pediatrics at the George Washington University School of Medicine and Health Sciences, and I'm an attending physician and director of our multidisciplinary pediatric HS clinic at the Children's National Hospital in Washington, D.C. So I think asking about it, first of all, because I see a ton of HS, and this still ends up being like a hand on the door kind of question where they come in for something else and they're like, also, she gets some boils in her groin, or she gets ingrown hairs in her groin. And the kid's always embarrassed and they don't really want to talk about it. And so they may not bring it up until it is really bad. So doing an exam in those areas, even if it's just the underarms, if they're not comfortable with a groin exam, making that part of what you're doing in adolescence. And if there are patients who have some of these comorbidities that we know are higher risk, patients with, for example, Crohn's disease, patients with obesity, polycystic ovarian syndrome, severe cystic acne, asking them if they have anything in their underarms, in their groin, if they have any painful spots that are coming and going. It can occur on the chest, it can occur on the buttocks. These are all common areas where we see it. And especially for patients with, PCOS who may just report these as ingrown hairs, or patients with severe cystic acne who are just like, well, this is just acne. So I've told you I have acne. That's all you really need to know. Um, Screening for it in those patients is helpful to recognize it early and refer early because the treatments for those other conditions may not necessarily help with underlying HS or may not give you as much control. So recognizing patients who are higher risk and screening, it's super easy to screen. You can just ask them in the last year, have you had two or more outbreaks of painful bumps or boils in any skin fold areas? That's it, period. That's all you have to do. In adults, that question is 96% sensitive. So you're going to catch almost all patients with HS, and it's also quite specific. So, really easy screening question, especially to throw in for your patients who are higher risk. That would be something to help recognize this early.